PIG members, it's Jena from the Wellness Center, and I'm here this week to talk to you a little bit about our annual screening mammograms. So I'm pretty passionate about breast cancer prevention, so this is an important tool we have here for you to make sure that you're up to date on your yearly mammogram screening. I wanted to talk to you a little bit about expectations for the mammogram, the current recommendations, and also other things we can do to reduce our risk of breast cancer. So let's first talk about who's eligible for their screening mammograms. Every female above the age of 40 is recommended to get a yearly screening mammogram to look for any abnormalities in the breast. This recommendation can change if you have a significant family history of breast cancer. So that's multiple family members being diagnosed with breast cancer, or early diagnosis of breast cancer in the family, which is, we usually typically say that anybody getting diagnosed with breast cancer before the age of 40 or 50, definitely talk to a provider here at the Wellness Center or your primary care provider locally to see if you qualify for earlier screening for breast cancer. I wanted to talk to you about some tips for the day of your mammogram. They do recommend not wearing any deodorants, perfumes, or powders in your armpit or just on your body, just to avoid any artifact of the imaging that will make you repeat the imaging. So that was just a tip or trick. And another thing I wanted to talk to you about is there can be some anxiety around attending this appointment for your yearly imaging, specifically in the populations of people who have had a personal history of breast cancer or have an extensive family history of breast cancer. You might be putting off this screening as it causes you to be worried, but as you can imagine, it is a really important tool for you specifically. So something I had a patient recommend getting, like your sister, grabbing an aunt or a friend, your ladies in your book club, someone who can keep you accountable for getting that annual breast cancer screening done, and maybe celebrating with them after everybody's completed their yearly screen. Go out and go to a movie or something fun afterwards to celebrate something that you've done for yourself. I also wanted to talk to you about ways we can reduce your risk of breast cancer. Some of those being, we talk about eating a well-balanced diet and exercising regularly. That is actually really important in lowering your risk of cancer. So just another benefit of both of those things. Also limiting stress, taking care of yourself with deep breathing exercises, yoga, moving your body can do your body really good in cancer prevention as well. We do recommend limiting alcohol use because this has been shown to increase risk of breast cancer too. So for females, we do recommend 1 serving of alcohol or less per day, trying to always avoid binging or drinking over 4 servings of alcohol in one setting. And then, with alcohol, the least amount of alcohol consumed, the better, honestly. So, especially if it lowers our risk of cancer. Also, just talking, if you do have a family history of breast cancer, it's just making sure, again, talking with a provider, seeing if you qualify for genetic testing possibly, or sooner screening for breast cancer. I also wanted to talk about some signs and symptoms. If you are even younger than 40 and think you've noticed some breast changes, that's also an important time to talk to a provider. So if you've noticed any lumps, bumps, nipple changes, so that we're specifically talking about inversion of the nipple, or if your nipples are inverted, them changing in that way, or any discharge, bleeding, or any breast or nipple changes. So this would be a time for you specifically to reach out to a provider for an exam and to see if you qualify for any breast screenings before the recommended timing for that. So again, the providers here at the Wellness Center are always open to talk to you and see what your risk is, if we should start screening sooner, and also just to order your normal annual screening mammogram. Please contact the office if you'd like to talk to one of the providers, or if you think you are due for your screening mammogram, and we'd be happy to help you. Again, thank you for tuning in this week. I hope you all have a fantastic rest of your week, and let us know if you need anything here at the Wellness Center. Take care.